Great. Thanks, Marissa. That's great. Marissa and myself have just been having a conversation actually about some of the feedback that a lot of the Ignite users gave last year about perimenopause being a really important subject that they wanted to have covered this year. So it's awesome to be able to be giving you the information and being invited to do that together. I've got some slides and I've got a whole varying amount of information to give you today, but I'm going to try and keep it really concise. The title of the presentation is Perimenopause 101, so it's going to be a broad range of basic information. You will find me generalizing a little bit as well. The reason for that is because perimenopause is a many and varied experience for women, and so I can't sort of talk to all the nuances in the presentation today. But I will give a broad overview and talk about some of the things that we can do to manage through that transitionary phase. So I'm going to share my screen. Great, cool. So the title of the webinar today, Perimenopause 101, what you need to know if you're a woman or if you know a woman over 30. The reason I gave this title is because I was hoping that it would be a way for women to learn the basics about perimenopause, but also to be able to share that information with loved ones and family members, significant others, as a way of helping to put out the learning and the education about this transitionary phase that most women are going to make in their lives. I have been working with perimenopause women for a while now, and I feel like I've got a really clear understanding of some of the challenges that happen. And so we're going to talk about some of those today. Just a little bit about me. So I'm a registered nurse. I also train as a naturopath. I've got a really strong interest in gut-related issues and mental health issues. And that was a specialty that I had for quite a number of years. I studied clinical hypnotherapy and also completed training in psychotherapy, because one of the things that I was noticing in my practice is that actually people's mental wellness was contributing to their physical experience of wellness. And I felt it was really important to be able to offer treatments that were able to cover all the different bases and be truly holistic. And then I entered perimenopause, and it kind of threw everything upside down for me. I thought I knew quite a bit about women's health and hormones, but I actually didn't really know much about perimenopause. And it wasn't until I entered into that phase of my life that I started to have some difficult experiences and gather information. And now I mainly do my work with women in that midlife transition phase. I started the transition at 40 and had an experience of like a chronic fatigue type syndrome. And we'll talk more about what that looks like and how that shows up later. And I noticed that because of the lack of information and support that I was getting through information through my GP, for example, wasn't really aware of what was going on for me. I decided to arm myself with lots more information and focus on that particular area. So presentation today, what we're going to learn. So what the heck is going on? And this is one of the things that I often hear women saying, and sometimes their significant others or partners or people that have family members that are going through this transition. What the heck is going on? What am I meant to be doing about it? I really do believe that when we know what's happening and why it's happening, then we can make informed decisions about what's best for us moving forward. We'll talk about the signs and symptoms and some of the main ones that people might experience. There is a list of about 35 well-known signs and symptoms, but that list is growing, it seems, almost every week as there's more research and understanding about how the changes in hormones affect us in many different ways. We're going to talk about the tools to help you and also what can be done. So these two things are going to merge together near the end of the webinar today. And then we'll also have a time for questions at the end as well. So about 2 years ago, I started doing quite a big piece of informal research where I interviewed about 40 women about perimenopause and what their experiences were entering into perimenopause, what it was like for them when they were seeking health with health professionals. And for some women, they'd sort of come out the other end of perimenopause, and it was a retrospective piece about what would have been helpful for them during that time. So there was kind of three main things that came out of that. So the question, what is happening to me? So many women, they don't know what perimenopause is. That's starting to change a little bit more now than even a few years ago. So when the changes start to happen, women would often feel a mixture of emotions such as fear, confusion, and grief. For a lot of women, they'd have an experience of their health declining or feeling like it was out of control, and the usual things that they would do to keep their health on track weren't working anymore. So a very confusing place and upsetting for some people. Um, what also happens is because we have the changes in the mainly progesterone and estrogen, they also contribute to affecting our hormone symphony, which is thyroid hormones, or perhaps the hormones that have to do with managing our stress response. And so it can feel like lots of different things are changing. And again, that can contribute to this overwhelming sense of dread or confusion, or is this what it's going to be like for the rest of my life? The next thing that would often come up in those conversations with women is, why is this happening to me? So unfortunately, and this again is starting to change, very few women really understand what their sex hormones are and how they affect us on a physical, mental, and emotional level. So again, people are saying, what is happening to me and why is this happening? And not really having an understanding about the driving factors or the contributing factors to their well-being experiences. And again, this feeling or sense of being out of control was coming up quite a bit in that piece too. And then the other question that was coming up is, what can I do? Will I ever feel like myself again? So women not knowing what to do, getting lots of conflicting advice or conflicting evidence as well. Lots of opinions about the best course of action, and some women experiencing a sense of loss of themselves. And again, is this me for the rest of my life? And a real fear that this change in health status was going to continue long term. I know that was my experience too, feeling like especially with the fatigue, is this me? Am I going to struggle forever? And the good answer, the good response to that is, and that was my experience, is no, you won't have to struggle forever, because there's plenty of things out there that can help you. So the message today, again, is when you know what is happening and why, then you can make informed decisions about what is best for you. And I also just want to add in here that this webinar is about the signs and symptoms that you may experience during menopause. I'm not trying to frighten anyone or demonize perimenopause as this terrible experience, because what I do know is that there's like a whole spectrum of experiences that happen during perimenopause, and I call them the 3Ds. So for some women, they don't really notice much, and they find that they just kind of move through and they don't really notice many changes. For some women, they find the changes difficult, and so they might have some physical or some mental, emotional difficulties during that transition. And for other women, it can be debilitating, and it can actually affect their work. You may have heard stories through on the media or even through friends or colleagues that some women actually do end up leaving work because their symptoms become so debilitating. So I don't want to frighten anyone, or but what I do want to do is present, some of the symptoms that people will experience, and to let people know that perimenopause is a normal thing to happen. There is nothing wrong with you, but you may be having signs and symptoms that can be managed or mitigated or reduced through different treatments and resources and support. So, what is perimenopause? It's a transition phase when female reproductive organs or glands and hormones start winding down, and I'll go into more detail about that in the next couple of slides. The changes start for most women in their late 30s to early mid-40s. Some women do enter perimenopause and menopause earlier than that. And if that is the case before 40, then there's I would encourage you, if that has happened to you, to go and see your GP just to get some health checks in place if that is the case. Declining progesterone in conjunction with fluctuating estrogen and then low estrogen. So that's the typical pattern that starts to happen. I'll go into more detail about that soon. can last for 2 to 10 years with a range of symptoms from mild to debilitating for others. This is a really important piece, number 5. It's a critical window for future health outcomes, and when managed well, it can set you up for future well health. So what do I mean by that? I'll mention 2 pieces. So one is during perimenopause, the way that our body manages glucose and insulin changes. And some people may be aware that estrogen helps our cells to be more sensitive to insulin. So it would mean that as we get changes in the amount of estrogen in our body, that our sensitivity or insulin sensitivity will reduce, which can lead to pre-diabetes or not managing sugar that well in our system. And that can set us up for changes in cardiometabolic health, so heart and cardiometabolic disease in the future. So perimenopause is a time when you really want to pay attention to your health and utilize it. It can be a really positive thing because it means that you actually have to start getting a little bit more real about looking after your well-being and focusing on your physical, mental, and emotional health. So it's a time of reassessment on an emotional, physical, and mental level, and it can be a time of celebration into another life phase. And I think this is a really important piece. It's not often talked about, is because there is a recalibration and a change going on in our system. We're going to need to start doing things perhaps a little bit differently, with a little bit more awareness about how we're doing them and whether they're actually good for us or not. I might ask my clients questions like, are you a people pleaser? Are you a perfectionist? Are those things no longer serving you? Do you tend to put other people's needs before your own? Do you only sleep a couple of hours a night? Do we need to look at that? And is that going to be something that you can continue doing and going into this next phase? So it can actually be a really helpful time where we can get real about what's working for us and what isn't. It's a recalibration of the brain, like a second puberty. I'll talk more about that in the coming slide. But again, really important that we understand how the hormones or the changes in the hormones affect our brain chemistry. And if we can get it right and look after ourselves during that time on a mental and emotional level, it actually, there's lots of studies that show that it actually helps set us up for better mental well-being and brain health in the future. Number 8. So there can be an exacerbation of current health issues or underlying health niggles. Again, really important to get any of those addressed. Cognitive symptoms can be one of the first signs for some women. So brain fog, difficulty recalling words. I know that was one of the things that I first experienced and still do. So if that happens today, please bear with me. Cognitive symptoms are the most common first symptoms as well, studies are showing. The veil becomes thinner. And for some people, there can be more pronounced anger, frustration, dissatisfaction. And I refer to this as a midlife slump. I've actually done quite a bit of research into this. And I find it curious that often perimenopause comes in that midlife stage for women when there is a tendency to have lower life satisfaction. Now, I want you to know that there's nothing wrong with you, because this dip in life satisfaction is seen all over the world. It's seen in men and women, and it's seen in many, many different cultures. So yeah, there's nothing wrong with you. That is actually in kind of a normal transition that we go through when we might question where we're at in life and what's working for us. The good news is it doesn't last forever. And again, in that research that I've been looking into about this midlife slump, women tend to be happier and have more life satisfaction after midlife. So that's good news. So let's look at the perimenopause phases, and I'm going to talk a lot about hormones and how they affect our physical and emotional mental well-being here. I mentioned earlier that perimenopause can last from like 2 to 10 years, so it's quite a long period of time in our lives. And I've broken it down here into a few phases. So the first one is very early perimenopause. And again, I'm generalizing here. It can last about 2 to 5 years. Often in this stage, regular periods are still happening, but there may be signs of change. So you might find that your periods are getting a little bit heavier or a little bit lighter. The cycle length may vary every now and then. So the first phase is we've got fluctuating estrogen. So estrogen is going up, and actually estrogen can go higher during this stage than in our reproductive years. And one of the main things that starts to contribute to a lot of our symptoms is a lowering of progesterone. So I'll talk a bit about those. So progesterone, that is a hormone that we create in the last half of the cycle. So if you've ever experienced PMS before, or you find that that week or two before your period in the past, you may have had difficulty with mood or with energy, or maybe increased pain. That is because of progesterone. So progesterone keeps us cool, calm, and collected. It's also slightly anti-inflammatory and has a calming effect on the brain. So in that early phase of perimenopause, our progesterone is starting to lower. So that cool, calm, and collected hormone that we have is starting to reduce, which can impact on our mood, and also can contribute to sleep disturbances, which I've mentioned there. We can also tend to have heavier bleeding in this stage as well. Now, the reason for that is because estrogen, which is fluctuating, so that's going up and sort of coming back to baseline and going up again. Estrogen is a proliferative hormone, which means it proliferates the lining of our uterus, which is really important during our reproductive years if we're wanting to have children, because that provides a healthy place for an egg to implant. However, during this phase, with lowering progesterone, and increasing estrogen, we can start to get a more proliferate lining of the uterus, because progesterone helps to temper estrogen. But because progesterone is falling, estrogen is staying up, which means the lining of the uterus is becoming more. So that's just a really important thing, I think, to look out for, is that if you are starting to have heavier bleeding, then there are things that can be done to support that, such as menopause hormone therapy in the form of progesterone. But then there's also a link between mast cell and histamine production, which also contributes to that. So I'll talk about that now. So mast cells are the cells that produce histamine. Now, you probably know histamine as that thing that goes around your body when you have pollen, or if you have an allergic reaction to something, and your eyes might get itchy, and you might tear up, or you're sneezing, or you might find that you've got a skin irritation, so you get itchy skin and it kind of welts up in a red rash. So that is histamine. The interesting thing is histamine is also a neurotransmitter, and it's an excitatory neurotransmitter. So if you've got a lot of histamine cruising around your body and it's going into your brain, you're more likely to have anxiety or nervous tension or difficulty sleeping. The other thing that can happen is this high histamine production actually can lead to a higher estrogen, which means more lining of the uterus. So that's another way in which you may or may be contributing to heavy bleeding. So just to cover that again, early perimenopause years, you have fluctuating estrogen, your progesterone is going down. Progesterone is the thing that helps you to stay cool, calm, and collected, and helps you to sleep well, and keeps your moods regulated. So that's the first piece. But your periods will probably still be staying regular. Then the next phase is the early perimenopause transition phase, which they say about 3 years. Again, I'm sort of generalizing here. And so that's when you get the onset of irregular periods, and cycles can vary by 7 days or more. Your progesterone still continues to go down. So again, anxiety or sleep disturbances, things like that may start to either start or may worsen. And then your estrogen actually fluctuates, and it actually starts to drop below the level of the reproductive years. And that drop, or that sort of going up and down of the estrogen, that can lead to the hot flushes and the night sweats that we often hear related to perimenopause and menopause. Also, the other thing that can happen is, as the lowering of progesterone levels in the body, some women might start to get heart palpitations as well, or racing heart. And that's because progesterone also is very protective of the heart too. So as those changes start to happen, that's another sign of that. The other really important piece is immune system remodeling as well. So some people find that they might have a tendency to get sick a lot more, or show signs of low immunity. And again, this is one of those times when the remodeling of your immune system is starting to happen here. So it's really important that we take really good care of ourselves during that phase, or during this phase, so that we can make sure that our immune system is remodeling in a really robust way. For some people, if they have an underlying autoimmune condition, that can start to pop up and make itself known in this stage as well. Then we've got the late perimenopause transition. So that's when you're getting skipped periods, and you may have 60 days without flow. Progesterone no longer fluctuates, and actually it's almost non-existent. And estrogen continues to decline. So we're not getting so much of that up and down. We're starting to get a bit more of a regular decline in the amounts of estrogen in the body. Again, that lowering estrogen contributes to the hot flushes, night sweats can intensify, and that dropping in estrogen also can contribute to sort of an increased irritability and depression. And for some people, there can be sort of experiences of rage as well, or dissatisfaction that can come through. Again, there's nothing wrong with you intrinsically when this is happening. And what it does mean is that you may need some support and some interventions to try and help manage or mitigate these experiences that you're having. And then you've got the late perimenopause transition. So it's the first cycle of more than 60 days. I see a typo there. And it still could be another 4 years before you actually reach menopause. So remember, menopause is when you've been 1 year without a bleed. And so lower estrogen and progesterone is flatlining. So there's pretty much no progesterone, but estrogen is still being provided or created, but just in very small amounts. The good news is that for a lot of women, the uncomfortable symptoms begin to subside unless another period arrives. And in that case, where estrogen is kind of doing this again, often the difficulties in a lot of these symptoms can be attributed to this fluctuating estrogen. Right, thanks for sticking with me through all of that. So here is a list of some of the most common symptoms or signs of perimenopause. I mean, I want you to just take a bit of a look at that and see if you identify with any of those. Maybe if you're not in your perimenopausal phase of life yet, do you already experience some of these? And if so, those would probably be the types of things that you would need to be really aware of as you enter those perimenopausal years to start looking at. For some people, these symptoms, they may never have had symptoms before, and these things start to pop up. Again, it's really important to know, or to have some understanding, I believe, of some of the hormonal implications, because then it helps us to know that we can actually do something about the signs and symptoms that we're experiencing, and we don't have to sort of suffer in silence, as it were. So this here is a resource that I created last year, based off the back of this informal research that I did with these women. And so I've created 2 resources, and one is the A to Z of perimenopausal signs and symptoms. I think from last count, I had about 32 signs and symptoms in there, and there's a brief bit of information about each of them and why they're happening. And then this other thing, which I'm actually really happy with, which is a perimenopause symptom tracker. Now, the reason that I created this is because it helps us to get a real sense of what's going on when we can track our symptoms month to month. It can help us to see if there are patterns that are happening in our symptoms. that we can then take to our GP or our health professional or a specialist when we're wanting to get support or maybe some medical or other sort of interventions. The other really important thing about this is it can also help us to see when we do sort of start new interventions or we're adding new things in, what's working and what isn't. So these resources are available if you want to write this down. So if you go to myperimenopausetracker.com, so the URL's at the bottom of the screen there. If you go there and you'll put in your name and email address and you'll get these sent to you. Now, full disclosure, that will put you on my newsletter emailing list. If you don't want to be on that, that's fine. You can get yourself off that list or unsubscribe. So myperimenopausetracker.com. If you go there, you'll get these resources, and you can either stay on the newsletter list or you can unsubscribe. But no problem at all. But you've got these there that you can use to give you some information or some more detailed information about some of the signs and symptoms, and also keep track of what's going on. So just looking at time. So some resources, tools, information, and support. So I won't spend too much time on these, but I wanted to illustrate that there's so many things that we can do to support ourselves and other women or the women in our lives going through this transition. So reassessment, and this is when we kind of have to spend a bit of time with ourselves and kind of get a little bit real with ourselves. What is working, what is essential, and what is not working. There's a fantastic book which I have used myself and with my clients called Essentialism, which is really, really helpful for dialing down and finding out what are the things that need to stay in my life during this transition phase, and what are the things that are unhelpful and that need to go. So that book again is Essentialism by Brett, I think his name's Brett McEwen, maybe. Really, really good resource. Number 2, getting resourced, finding good quality information and understanding what's happening and what options you have. So again, another great resource, a website that you can go to is the Australasian Menopause Society website. They've got really good resources and really good information. They also have a list there of New Zealand GPs that have done specialist training in perimenopause and menopause support. So that can be a really great place to go and find a GP if you're looking for someone that might have a little bit more experience in this area. And I recommend that you do that if you're finding that you're not quite getting what you need from your current GP. Nervous system. Get to know your nervous system. What stresses you out? What calms you down? Can you do more of the things that calm you down and do less of the things that stress you out? And learning strategies to regulate. Again, this is a really important time for that recalibration of our brain. And it's just so important that we actually put ourselves first some of the time in our mental well-being. And if we can, spend some time looking into ways that we can help to regulate our nervous system. And it doesn't have to be big, massive changes. It can be something as simple as taking 5 minutes a couple of times a day to listen to a relaxing music track, or watch something funny. I know some of my clients have a funny file on their phone where they just put a whole bunch of funny things in there, videos and things like that they enjoy to give them a bit of a boost. It's again, it kind of goes back to this reassessment. We've got to spend a little bit of time with ourselves and ask these questions. What do I like and what do I not like? What's good for my nervous system? What's not good for it? Food. I've put here simply, add in more good stuff, remove some of the not so good stuff, and manage your blood glucose levels. So I think one of the most important things we can do is, instead of going on diets where we're removing gluten and dairy, which are helpful, don't get me wrong, often an easier place to start is actually deciding to add in more good stuff. So can you add in more fruits and vegetables? Can you add in more water and protein? Those are really good places to start. And managing your blood glucose levels. Again, this is really, really important. We don't have the space to go into that today, but getting some information about ways to manage that, and your GP can be a good starting point with that too. Sleep, making it a priority. And if sleep is difficult, look to manage this. And that's because so many things during our sleep, like our immune system and our brain function, are actually supported and nourished during that time. So we need to make sure that we're getting enough sleep. Easier said than done sometimes. I totally get that. And one of the main signs for women of perimenopause is disrupted sleep. Progesterone, taking progesterone at night can help with that. There's a whole bunch of herbs and nutraceuticals. One tip that I will share is, in order for our body to go into sleep, the temperature of our body needs to drop slightly. So if you're in a hot environment, or you find that you're sleeping really, really hot, finding ways to keep cool is going to be one thing that can help with sleep. So, and if you're waking up in the middle of the night and you're finding it difficult to get back to sleep, actually getting up for 5 to 10 minutes, not turning on too many lights, but trying to cool your body temperature down outside of the bed, and then going back to bed, studies show that that can actually help. Medications and supplements is another resource or another tool that you can utilize. So there's menopause hormone therapy, and again, you'd need to speak to your GP or a specialist GP about that. Some people find a lot of benefit through supplements and nutraceuticals and other medications for health conditions. So some women might choose to go on to antidepressants during perimenopause to manage some of their symptoms. And some people may find that they need to go on to other medications for pain management or headache management as well. I think it's really important that we can get really logical and practical sometimes about our experiences. You may be the sort of person who might tend not to take medication. That's absolutely fine. And I think that sometimes is it worth taking a medication, or is it worth exploring some way in which you can reduce your signs and symptoms to give yourself a bit of a rest? For example, do you have chronic pain? Is it worth taking something for a week or two to give yourself a bit of a pain holiday so that you can get back on track with some of the other things? So just some food for thought. Utilizing professionals, GPs, naturopaths, counselors, therapists, body workers, listening to podcasts or reading books. So Dr. Linda Deer is a great menopause specialist GP, and she has so many great pieces of information that are available to you. And if you search for Dr. Linda Deer on the internet, you'll find so many resources available to you. So I think that's a really good place to start. So not all GPs are specializing in a menopause hormone therapy or menopause support. And if you're finding that you're not quite getting what you need from your GP, then I encourage you to actually maybe find another GP that specializes in this area so that you can get the care and support you need. Take care of your mind. And I've mentioned this already, what serves you and what doesn't. And looking at some of the ways that we show up in the world with people pleasing or perfectionism or stonewalling. What are the ways in which we are managing ourselves? Another thing which is often undervalued is getting support. So connecting or reconnecting with others. That could be friends, or that could be family members, or maybe finding connections in a community. Learning self-compassion and kindness towards self. We could do a whole webinar about that. And that's so important. And one of the things that I find with a lot of my clients that we end up doing some work around. Looking after ourselves and a sense of self-compassion and understanding that, again, there's nothing wrong with you. You're having an experience, a normal transition phase through life. And for some of us, it's going to be okay and fairly easy. And then for others, it's going to be really, really challenging. Doesn't mean there's anything intrinsically wrong with you. You're having a physical or emotional, mental response to changes in hormones and changes in your physiology. And there are things that can be done to support that and make it easier for you. Number 10, ask the embarrassing questions. You may have changes that are happening in your reproductive organs inside. You may have changes happening in the vagina or your vulva or your breasts. You may have interesting smells or interesting things coming out of your body. It's important to ask the questions about what is going on with those things and get them attended to. So again, asking friends or speak to a GP or health professional. Often things can be managed, improved, or resolved. And there's nothing quite like sitting there worrying about something that's happening to your body and not knowing what's going on. I know sometimes it can feel difficult to access and go and see professionals about these things, but actually knowing what's happening so that you can do something about it is going to put you at ease. And again, sorting out any health issues. So something isn't right, get it checked, and keeping up to date with our female health checks. So those are sort of 11 resources, tools, informational support that I think are really important, and important for us to utilize going forward as well. So managing perimenopause checklist. So what can you do? So downloading the A to Z and perimenopause tracker and getting acquainted with your cycle and your symptoms as well. Getting good quality information so you can make informed decisions. This is really important. So addressing the physical, emotional, and mental elements that are important to you and seeking support if needed. So I think it's really important here that, again, we really spend time with ourselves and decide what's actually important to me and how do I want to go about managing this. There's lots of different ideas and pressures and influences about what we should be doing, but this is actually a really important time for us to go, what's important for me? And what do I need to do to manage this phase and going forward? Get resourced and do it your way. And most importantly is, can we start having conversations with other women and share knowledge and understanding so that we don't feel alone in our experiences. There's plenty of people out there that are having difficulty during perimenopause. And again, it doesn't mean there's anything wrong with you intrinsically. You're having a physiological, emotional, mental response to changes in your body. So here, this is just how to connect with me if you wanted to ask any questions or get on a newsletter list. I'm also a practitioner that offers my services through the Ignite platform. So you can also go on and make an appointment with me there. And on these platforms here, I share just a lot of free resources or a lot of information and tools about different things that can help manage the different pieces that come up during perimenopause. And I think that's me. I've actually done fairly well, I feel, in a short amount of time. So thank you so much for joining me today. There is so much more I could have said about all of this, but if there's any sort of personal information or personal stories you want to share or any help that I can provide you, then you can find me on the Ignite platform. Yeah,
Jodie.
yeah,
Thank you.
Thank you.
That was awesome. I can see we've got a couple of questions in there already, so we'll dig into that. I've got one. Can perimenopause affect your tolerance to things like caffeine?
Yeah, absolutely. Absolutely, it can. I'll talk a bit more to that. Marissa, should I stop sharing screen so that you can see us, or is it better? Yeah, okay, cool. Cool. Yes, absolutely it can, and there's a couple of reasons for that. So caffeine is a stimulant, and the way that it actually gives us energy in the body is it stimulates, or one of the ways it gives us energy is by stimulating cortisol release into the body. So when we're in perimenopause, the lowering of the progesterone, that actually affects our ability for some of the other hormones like cortisol to modulate. So, and the other thing too is because of the changes in the histamine levels, that can also mean that you might be more sensitive to things like caffeine as well. So yeah, absolutely. I'd be interested. I wonder if that person has noticed that there has been some connection there for them.
Yeah. Is there any information about how IVF cycles might affect the onset time of perimenopause?
Oh, that's really interesting. So that's definitely not my area of expertise, but I would imagine that there will be information out there. And this is, it is actually a question I've pondered myself. because I would imagine that the hormones and the medicines used during that time would have an effect. But I cannot answer that question to the degree that it would need to be answered.
No worries.
However, if that person did want to contact me, I'd be more than happy to have a discussion about that and try and find some places that they could actually get the answers that they want.
Awesome, thank you. Someone said, is that why antihistamines make you sleepy?
Yeah, so that is a part of it, absolutely. Yeah. And some women do find that taking antihistamines do actually help some of their signs and symptoms as well. So maybe I'll just talk about histamine a little bit more quickly. So one of the signs that we can see that histamine might be an issue is if we're still cycling regularly. In the middle of our cycle, that's when we start to get a surge of estrogen. So if you notice that your signs and symptoms tend to worsen during mid-cycle, that might be a sign that histamine might be a culprit. Now, the good news is there's heaps of stuff you can do about that. The first port of call would be introducing an antihistamine like eating plan, because there's actually quite a few foods that contribute to histamine levels in the body. And the good or the bad news is, depending on which way you look at it, is that alcohol, especially wine, is really, really high in histamines. So if you're drinking wine or other types of alcohol, but wine, and you're noticing an exacerbation of your symptoms, there's also a high likelihood that the connection could be histamine, too much histamine in your body. So fermented foods, even sauerkraut, for example, also have a lot of histamines in them.
That's really interesting.
It's really fascinating. And remember, histamine's a neurotransmitter and it's excitatory, which means that if we want some of it, but if we've got too much of it, we'll have more of a tendency towards anxiety, sleeplessness.
Gotcha. And another question here from someone who's 54 years old. They've said, as far as I can remember, from the moment my period started, it's very irregular until it stopped in 2019. Do you think that's normal?
To have irregular periods. I would imagine that if that is the case, there might be some other sort of hormonal thing happening. The first thing that comes to mind is here's that perimenopausal brain fade I was talking about. Yeah, so irregular cycles like that. I mean, the word normal is an interesting word to use, isn't it? It would mean that there'll be something happening. I would imagine that it might be something like polycystic ovarian syndrome or an ovulatory cycle, which means when you're not ovulating. So I would imagine that it would be something like that that would have been going on.
Gotcha. Someone else has said, my biggest struggle is sleep. Is it advisable to use sleeping pills during this time?
Yeah, that's a really good question. I know the temptation is there to use sleeping pills because not sleeping is crazy making. And I know because that was my experience as well. So I really feel for you. There is a lot of other things that can be done to support improved sleep. And so sleep hygiene is one. It's not always the answer, but making sure that you set yourself up with a good sleep routine. Simple things like no screens after 8, not eating too late, making sure that you don't have too much caffeine or having caffeine earlier in the day. But if it is really impacting you, I would maybe suggest going and talking to your doctor about maybe even progesterone. Some people, depending on where they are in those phases, so we talked about those phases of perimenopause. In that first phase, as the progesterone is starting to go down, that can be a really good time of taking just progesterone, because that can help with some of the sleep or some of the nervous system things that are happening. I would say sleeping tablets, in my opinion, would be a last resort, because you don't want to become too dependent on them, but sleep is also important. But I would look, are there any other things that might be able to, like what I call low-hanging fruit, that could be addressed before you go to sleeping tablets?
Sweet. Thank you. Someone said, I think it's a addition to the caffeine and alcohol, saying they said they feel like they're allergic to alcohol now. Yeah, and I guess with the symptoms the stuff that you just mentioned before, that makes sense.
Absolutely, that'll likely be histamines. And also, our body becomes less good at managing sugar. And so alcohol traditionally contains a shit ton of sugar. And so again, your body's ability to manage that is reduced. And that can also contribute as well to anxiety as well. So that anxiety that one might feel after drinking too. Yeah.
Someone said they're experiencing a racing heart at night, that they can't seem to slow down with breathing techniques and it's keeping them awake. Do you have any suggestions to slow that down?
Yeah, this is the sort of person that I'd probably want to like sit down with and dive down a little bit deeper, because there could be a whole bunch of things that might be able to be managed to support that. The first thing is, if it's ongoing and it's starting to become frightening, then you do need to go to your GP and get that checked out. The likelihood is that it's nothing serious and it is that lowering of progesterone, but we need to make sure that that is the case. So that would be the first thing. After that, if your heart rate is like that, it could be because progesterone, like the heart palpitations that happen during perimenopause, and then that can sometimes trigger off anxiety. So I wonder if it might be this person might be stuck in a bit of a loop. And so therefore, tools to manage the nervous system would be really, really important. Again, it's hard to answer that question without knowing a little bit more information. But I would suggest that looking into ways to regulate your nervous system are going to be really important.
Cool, thank you. If you're on the hormonal contraception, such as the pill, do you still experience the perimenopause symptoms?
Yes, you can. Some GPs will prescribe women the pill during perimenopause. But yes, you can still experience symptoms on that.
Yeah. Do you need to use HRT medication during this life phase?
So you don't, can you repeat the question? Was it
Do you need to use HRT medication during this life phase?
No, you don't need to. If you want to, and it's going to be helpful for your signs and symptoms to manage those, then that is an option for you, but it's not a given and you don't have to. That's a discussion that you would want to have with your GP or a menopause hormone specialist if you felt like they would be helpful for you, but no one has to take menopause hormone therapy.
Are symptoms different post hysterectomy, and then in brackets kept ovaries?
Yeah, and so this is a really good question, and I didn't address this in the talk, so thanks for bringing that up. So yes, because what will happen is the likelihood of you producing progesterone will decrease, but you still will be producing some estrogen through the ovaries. So yes, some of your signs and symptoms may be different, but you still if you still have your ovaries, you'll still be producing some estrogen. So it won't be like going into medical menopause, because you'll still in a really nice way, you still be getting estrogen to help kind of ease, I suppose, the transition.
Oh, we've had another question about from someone who has had a hysterectomy. So they had it at age 34 and they're now 41 and they've had symptoms for a while. How do they know when they're going through menopause?
Yeah, so again, it'd be interesting to know if this person may have had a hysterectomy and had their uterus removed, but may also still have their ovaries. So the things that you would experience would likely be like the hot flushes, and some of like the mood dysregulation that would happen. Sore breasts can be another symptom that person might experience. Yeah, it's slightly different, but actually anything that sort of any of the symptoms around high or low estrogen, those will be signs that yeah, that they're in perimenopause.
Gotcha. Is there any connection between perimenopause and the exacerbation of ADHD symptoms?
Oh, it's such a good question. Yeah, so so in my experience, my clinical experience, I do believe that is so. And I think the reason for that is because we have this change in our brain, and we have this recalibration of our brain and our HPA axis, which is our stress response system. We have a tendency to maybe have an exacerbation of anxiety, or what's the other word that I'm looking for? Like racing thoughts and sort of a speediness about us. So yeah, absolutely. I get really curious about that from a psychotherapeutic perspective, because I go, oh, with the ADHD symptoms, I wonder what it is about our the way we organize ourselves in the world that contribute to that. And then we have an exacerbation of those signs and symptoms, or our experience of ADHD, because we've got this change happening in our sort of internal milieu, you could say. So yeah, I absolutely do think that would be the case. And people can experience new or exacerbated anxiety as well. So I think that's something to take into consideration. So is it ADHD symptoms? Is it some pieces of some sort of anxiety picture happening there as well? It's a great question.
Yeah, for sure. If you're on medication for hypothyroidism, can menopause still increase the hypothyroidism symptoms?
Yes.
Okay.
Yeah.
Oh, and we had another one. Can we please repeat the name of the Australasia website that you mentioned before?
Yes, absolutely. So it's the Australasian Menopause Society.
Oh, I'll just write that in the chat.
Um,
Australasian Menopause Society.
yeah. And they have a list there of GPs that have done their specialized training in menopause hormone therapy, or menopause support, which includes perimenopause as well.
Oh,
A bunch of great information on that site.
wait. Oh, so I've just chucked that in the chat for anybody who wants to see that. Just double check if there's any others. Was a couple of questions about whether the recording will be available, and yes, it will. I'll after this is finished, I will edit it and we'll get it up on our website and stuff, and we will send it out in a mail out, and it'll be on our socials and in our resource library next week.
That's great. Yeah, and if anyone does have any questions, again, they can always like maybe fire them through to you, or if they remember the details that I put up, fire them through to me, and I can answer those questions as well. Because it's really important. I've raced through them a little bit today because I could see that we had quite a few questions. So I couldn't, it's a shame I couldn't go into depth with all of those, but it's really important that you get these questions answered. So if I'm the person that can do that for you, sing out and get in touch.